Welcome to Community Watch, and today we're having another exciting conversation about COVID-19. Yes, the COVID has not left us, it's still here, and there's some important information you need to know. Stay with us. Community Watch starts now.
Welcome to Community Watch. Greg.
Good, doctor. How you doing? I'm doing fine, good, doctor. And yourself?
Well, I'm all right. I'm all right. It's good to see you. I think you're zooming in from another planet today, but
some would consider California a planet.
We haven't had an update on the health situation of Northwest Georgia in a while, so I figured it was time to have one of our favorite and regular guests, Dr. Gary Voccio. Welcome back to the show.
Thank you. Thanks for inviting me again.
And let me review again your lengthy title, which is Health Director for the Georgia Department of Public Health Northwest District.
Correct. Yeah. 10 counties from Paulding to Dade. And everything
must
in between.
Be hard to fit that on a business card.
Yeah. Well, it's good to be back. Thank you for inviting me again.
Well, catch us up a little bit. I know that the COVID numbers are down, but we're facing yet another variety.
Yeah.
And so where are we?
Well, there's the BA2 certainly is the majority of our cases. It's around 60% here in Georgia, 70% other parts of the country. It is more transmissible. It does not seem to be rendering at least a lot of hospitalizations. Our hospital numbers are very, very low, thank goodness. And deaths are even lower than we've ever seen. But it is more transmissible, and there is concern about some new variants that have been identified. Whether or not they're going to be more deadly or more transmissible, we don't know that yet. But the BA2 is still the virus of concern that we have been dealing with, but certainly the numbers look very, very low for emergency room visits, which we monitor, and hospitalizations, of course, which we monitor, and deaths, of course, which we monitor, which is really good. And these new variants coming, of course, they've identified them, but we do not know yet what it's going to mean for hospitalizations, cases, or deaths.
Dr. Voccio, I'm just going to be frank here. It seems to be a lot of confusion right now as we deal with COVID. And when I say confusion in terms of, I know in most places, a lot of masks are not required, but at the same time, it's recommended for some places. And it seems like we have this sense, or I have this sense that we feel like COVID, we are past COVID, but then I read stuff and I see reports that say we could see a potential surge later on.
That is, you've hit the nail on the head, what we've been dealing with for 2 years, Greg. You know, there's so much conflicting information and data. This virus is still considered a pandemic. I frankly don't think it'll ever go away. It'll become endemic, meaning locally, localization of the virus. But I certainly don't think it's ever going to go away. And there'll be new variants coming and going. And whether or not they'll be more transmissible, more deadly, we do not know that yet. If people are concerned, and you have to look at what your hospitalizations are doing, what your community is doing, then people who are more prone to become infected and die from COVID should be mindful of the fact that, yes, in a situation where they're in a lot of people in a church, synagogue, mosque, a store, restaurant, then they should consider wearing a mask. I occasionally do. I'm not inclined to do it as much anymore because I've been vaccinated and I've had my booster. And frankly, because I'm over 65, I'm going to get another booster this week. You know, the CDC has recommended it to people who are over age 65 or anyone who is immunocompromised. Frankly, we don't know if this, and there's again differences of opinion by these professional virologists and epidemiologists, whether or not a fourth shot is needed or not. I frankly think, because of what the literature I've been reading for 2 years, that after about 6 months, your immunity does wane, your antibodies do diminish, then I'm going to get another booster because of that. Now, there are other sides to this that say, well, your immune system should be greatly intact, and that if you encounter COVID again, meaning me, if I encounter COVID again, I should have a fairly brisk immune response, and I probably would. But I do know that over age 65, and I'm 67, that my immunity won't be as robust as if I'm a younger man like you, Greg. So I will get a fourth shot. And if I'm in situations where I'm concerned because of the community's level of COVID, the hospital numbers show that, yes, they're seeing significant increase in numbers of COVID cases, then I would wear a mask. And if I'm concerned in a situation where, gee, I do not know if these people are vaccinated or not, and I'm at risk, I will wear a mask. So it's individualized, in my opinion. And that's why I recommend making these recommendations, that I'm going to get a fourth shot this week. And if I'm in a situation where I feel uncomfortable or where the numbers are showing an increase, I will wear a mask. It's, in my opinion, you have to individualize it.
Well, since you brought up the it's not a new booster. I mean, it's just a new recommendation on booster, another booster.
Correct.
Is there a sense that maybe the booster did not last as long as folks thought it would, or was not as effective, or if the taking another booster, is there a chance of the boosters becoming progressively less effective from taking so many?
We do know that the Omicron variant, after 2 shots of the mRNA, you got a response, but it wasn't as robust as opposed to the Delta variant. However, after 3 shots of an mRNA vaccine, the response against the Omicron variant was fairly robust, a good response against the Omicron variant with 3 doses. And in fact, even a more robust response if you had prior COVID and got a 3rd shot. So after 2, it wasn't that good, but after 3, it was. And it does wane after approximately 6 months. However, like I said, there are experts who think that your innate immunity with your antibody response should respond to another COVID infection. That's probably true, but I think that with a vaccine, you'll have an even more robust response, and that's been demonstrated, and that's why I'm getting the 4th one. This virus is, like I said, not going to go away. And I had COVID last Christmas, and I had 2 vaccines and a booster, and I frankly think I would have ended up in the hospital, possibly died if I had not been vaccinated. I really think that. But I had a moderate case. I had fever and chills, and I was pretty sick for a couple of days, and was back at work at day 6. Had to take days off, but I frankly think the vaccine really probably saved me a hospitalization at least.
So with that said, Dr. Voccio, so I guess where I'm at or struggling with is as I talk to people, particularly younger people, 50, 50 and younger.
Yeah.
What's the recommendation?
Well, I think that, the recommendation is to get a COVID series shot and a booster. And frankly, because people are extremely high risk of being hospitalized, 6 times the risk in Georgia, at least, of being hospitalized if you're not vaccinated, and 9 times the risk of dying if you've not been vaccinated. And those are the risks you take. Granted, the younger you are, the less likely you are going to be very sick, but there are chances that you can take and you may end up in the hospital and you can die. I mean, the vaccine is just a fairly easy shot to take. And that's why I'm strongly recommended. 6 times the risk of hospitalization in Georgia and 9 times the risk of death. Even young people die from COVID, and we've had young people die of COVID. And you just don't, I just ask people not to take that chance.
So if you are, let's say, 50 and below, and you haven't been vaccinated, it is still highly recommended that you get vaccinated.
Yes.
Okay. Now let's say you're 50 to 30 and you are vaccinated, but you do have high cholesterol, diabetes, some type of thing that may affect your immunity. Is it recommended then to get the 4th shot if you've been vaccinated and boosted?
That's a good question. If you're obese and you're diabetic, those are the 2 highest risk factors for COVID infection and dying. And I would say yes. The CDC is not recommending it, but our health department is not going to turn people away if they feel they want a 4th shot after they've got their series of 2 and a booster and a 4th. They're considering a 4th shot. I would consider it if somebody is obese or a diabetic. I would certainly consider it, yes. Or any immunocompromised state, if they're getting cancer chemotherapy, if they're a rheumatoid patient or immunocompromised in any fashion, HIV, certainly get your 4th shot.
Dr. Voccio, this is a question that there may not be an answer to yet, but do you anticipate that in the future will be offered a once-a-year vaccine, like a flu shot, or will it be these periodic boosters as we've had recently?
Probably similar to what we're seeing now with these boosters. Yeah, it's going to be the same mRNA vaccine that we're getting now. It's the same dose, the same medication, same messenger RNA vaccine. Probably so, yeah. And by the way, these vaccines have been again useful against so far all of the variants. More with the more booster you get, the more likelihood you'd be protected against coming variants.
And these boosters are available at the health department and a wide variety of other locations too.
Yes, health department, make an appointment, and yes, and private providers, of course. A lot of health clinics have them available. Yes.
Well, we only have a short amount of time in this segment, but when we come back, I want to talk a little bit about some of the different tests that are out there and differences between them, just because it confuses me a little bit. So let's go ahead and take our break, and we will be back with much more discussion with Dr. Voccio. Please do not go away.
I know you've had your moments of doubt and struggle, and I'm here to say I'm proud of you.
And although each one of us may take a different path, may we look back upon today as the moment we stepped into a larger world, a greater world.
You will pass this way but once. Do it right. If ever there was a time to follow your passion and do something that matters to you, now is certainly that time.
Welcome back to Community Watch. We're having a conversation with Dr. Gary Voccio, who is the Health Director for the Georgia Department of Public Health Northwest District, all 10 counties of that. I do have some questions about tests, Dr. Voccio, but during the break, you and Greg were talking about some travels you've been on. So it seems like a valid point to ask how safe travel is now.
Well, you know, in London, where I was for my granddaughter's birthday, she turned 5. They have lifted all COVID non-pharmaceutical interventions over there. And very interesting, when we had to come back to the United States, we didn't have to do any testing to go over there, but on the way back here, we had to wear a mask at the airport, on the plane, et cetera. It was very interesting. But to come back to the United States, we had to schedule a Zoom call, just like we're doing here. And they watch you take a nasal swab for an antigen test, and you download it, and they send you back the information within an hour, and you get it on your phone. And then you send that to the airline, and that's how they're doing it in the UK.
So I'm guessing that is that circumstance going to be the same from any country, or it just depends where you are?
That's the United States, you know, what's required by the United States to get back into the country, and so we follow there. You have to find a certified lab to do it, and this was done, interestingly, all on Zoom. And you have an Englishman, in our case, it was an Irishman, who I had very difficult time trying to understand what he was saying, but that's how it's done. It's you know, what they're doing here, I think, is very interesting, how we could do it here. It's so easy to do. It's downloaded, like I said, to your phone. And you're talking about testing. Interesting, you know, what we're seeing now is antigen testing in this country, which is another method of testing for COVID. But those numbers are going to be hidden by the fact that, you know, when you test at home for COVID, that's not placed in any kind of notifiable disease system that we have, for example, in Georgia or all the other states. So those numbers are going to be, you know, not available to public health. It's going to be very interesting to see.
So the test, what is the difference between the test that is being given, I guess still free at the fairgrounds in Floyd County? Yes,
that's a polymerase chain reaction, which is a you know, nucleic acid test, you know, still being done at the fairgrounds, and we have other sites in Chattooga County and Bartow County, of course. But those are nucleic acid tests, which are PCR. They're much more sensitive and specific, as opposed to, say, the Binax Now nasal card, nasal testing, which you do at home, which is not as sensitive and not as specific. If you're sick with symptoms, yes. If you test positive, most likely it's positive. But if you're randomly testing to see if you've been exposed, then it's not as sensitive. It's about 80% sensitive if you're asymptomatic. So 1 out of 5 will be a false negative test. That's the problem with those. But if you're symptomatic and you test positive, most likely it's positive. There are some false positives. It's rare, but it does happen. So that's the difference. One is much more sensitive and specific. That's the PCR tests that we're doing. By the way, other test sites are coming. In Gordon County, we're going to have a kiosk where you can test yourself. It's through the LTS lab that we similarly have at our COVID testing sites, but it's like a giant Pepsi or Coke machine that will allow you to put in your identification, your number. There's no tracking. This stuff is not trackable. but you can get your own test there, swab your nose, put it in the box like a big giant Coke machine, and this laboratory will pick it up, and with your self-identification number, you'll get your own COVID test back on your phone within a day.
Hmm.
And would that be a PCR test, Dr. Voccio?
Yes, it is a PCR, Greg. Good point. Very similar to what they're doing at the fairgrounds or Lake Point or the Colonnade in Catoosa County. Same test, but you do it yourself, drop it in the box. You'll have your own ID number where you can find it on your phone, and that number will be, that test result will be sent to your phone. If you have a phone, if you don't have a phone, there's other methods of getting that information to you. But that's going to be at this week, we hope, delivered to the Gordon Hospital, the Adventist Hospital in Gordon County on their campus. And it's one of 15 LTS lab sites that are going to be distributed throughout the state. And this is kind of a trial run for us. So that's going to be set up this week.
Dr.
Well,
Voccio,
Go ahead.
Doc.
Go ahead. You go, Greg.
I was going to ask, because I'm always very concerned how COVID is affecting different communities, and specifically the African American community. As we look here in our district area, I know since the beginning, African Americans have lagged behind in vaccinations. Overall, where are we with vaccinations in Georgia, in our district, and if you can, a breakdown racially?
Well, in Georgia, 65% of our Georgians have been vaccinated, but in Northwest Georgia, in our 10 counties, Floyd County leads the pack, and it's not very good. It's about 44% of our population has been vaccinated. In overall, it's probably on average about 38, 39% in Northwest Georgia have been vaccinated in our 10 counties. The demographics show that Asians are much higher vaccinated than any other demographic, and I think it's about 80 or 82%. Whites are vaccinated at around, as I recall, around 60%, Hispanics and around 42%, and blacks around 40 to 42% vaccinated. So the numbers really are very concerning to me. African Americans, as you know, Greg, have a higher incidence of hypertension, diabetes, and obesity. And those are the people that really, anyone with those medical conditions need to be vaccinated. But, those medical conditions are higher in the African American population, unfortunately. And those folks, those people really need to get vaccinated. Everyone needs to be vaccinated who are at risk, and those demographics really are at high risk. And we have tried with outreach to get people vaccinated, and it's just very difficult. But you're right.
Oh, I agree. In working with the health department and other entities, trying to do more outreach. But I guess what's confusing to me is that with the number of deaths that we have had with COVID, I don't know, it just seems like people don't connect the deaths with the virus. It's almost, we approached almost 1 million people, I believe, who have died from COVID. A million people. 1 million people. And yet people still refuse to get vaccinated as if somehow those deaths are not real. And I'll be honest, I'm at a loss as well. How do we get people now? Because at this point, clearly, I know in our area, if you wanted to be vaccinated, you can. And so I think we're just dealing with people who just choose not to, but that's confusing to me.
There's a lot of just misinformation out there. It's so easy to get access to information with all of the social media, et cetera. And there's just a lot of misinformation, people interpreting data incorrectly, and you just have to sort it out. And you're an educated man. You are so educated and know the literature, and you can sort it out, and you realize how deadly this virus is and how the vaccines can save people. And it's trying to persuade people. And I think people just finally got just got so tired of dealing with it. They just closed their eyes, their ears, their mouth, and their minds, and just didn't want to deal with it anymore. The people who are affected, with death, those are the people that finally succumb and say, yeah, I think it's time I'll get vaccinated, when they see their loved one die. And unfortunately, it takes a death to persuade somebody when that death could have been avoided.
Dr. Voccio, I did want to ask about the antibody test that's possible to get. Is there a value in it? Or
No. And I'll tell you why. There's no standardization. We don't know if the antibody test you get is a neutralizing antibody. We don't know if it's what the antibody really, what level is going to prevent you from getting COVID. Granted, the higher the level, more likely it will induce a higher antiviral response, but there's no standardization. It's like some labs measure in gallons and some labs measure in liters. Some labs measure neutralizing antibodies and some don't. There's no standardization of the antibodies. Granted, yes, you can get an antibody test and you have high antibodies. The experts really don't know what that means. Higher is probably better, but is it a neutralizing? Is it against the spike protein? What does it mean? There's no data to demonstrate one test is better than the other. There's no indication that it is useful.
And another question I was just curious about, I know that COVID and the flu are often compared in misleading ways, but the number of vaccines or the percentage of people who get vaccinated annually for the flu, is it a higher rate of the population than we're seeing with COVID? Is there more resistance to a COVID vaccine than to a flu vaccine, I guess is my question.
No, as I recall, reading quite a number of weeks ago, the population that receives the flu vaccine is about equivalent to what we're seeing with the COVID vaccine. Very interesting numbers. Unfortunately, the flu this year was very, very minimal. But unfortunately, I was going to say initially, the flu vaccine was only about 30% effective against flu this year, even though the numbers were low. It's only 30% effective. Vaccine effectiveness, it's called. So we missed the flu, but we missed the flu vaccine effectiveness also. And it's about the same number of people who are getting flu vaccines and getting COVID vaccines.
Well, we're about out of time here. Greg, you got anything else before we?
No, I'm at a loss still. I mean, I know right now the numbers are all low, but I'm just being watchful on the horizon, what's to come. You know, some experts say that we could have another surge later in the summer or early in the fall. So we're not past COVID. COVID's going to be here with us. We're not past it. That's my belief.
We'll have more variants and hopefully not deadly ones, but that may be the case. We just have to keep working at it. And I'll be glad to help you, Greg, with vaccines initiatives if you want me to anytime.
Yes, sir. I think we're trying to put together a drive later on this summer, in fact.
Let's do it.
Well, we are out of time. Thank you so much again, Dr. Voccio.
You're welcome.
Have you back again.
All right.
As soon for an update.
Greg, safe trip home.
Thank you, sir.
Thank you, and thank everyone for viewing us this time on Community Watch. We'll see you next time.